Hi everyone, I'm Amy Rose White, integrative psychotherapist. Welcome to my channel. This is part 3 in a 3-part video series on anxiety and panic and how to manage them on a deeper level. So today I'm going to talk about my 4 favorite supplements for helping support the body in its resolution of anxiety and panic. There really are ways we can support our biology while we're doing some of the other psychodynamic work around healing involved in anxiety and panic. So, number 4 favorite supplement is L-theanine. So, in this little bottle, you're going to see 3 main neurochemicals improve in your brain: GABA, serotonin, and dopamine. Now, GABA, what L-theanine helps GABA do is basically inhibits the excitatory nerve impulses in our nervous system that gets us in that constant state of what mental health therapists call hyperarousal. So getting GABA increased into the brain through L-theanine helps basically what we call down-regulate those systems, and it leads to a state of relaxation and calm. And what's significant about L-theanine is it crosses the blood-brain barrier, which a lot of supplements don't. And we believe that that helps make it more effective. Now, in EEG studies of people taking L-theanine, their brain waves actually looked more like those people who were meditating actively, meaning that they had higher levels of alpha waves going on in their brain. So it really does impact the brain in a very deep way. Common dosages are around 50 milligrams to 200 milligrams. And the good thing about this is you do notice an effect within 30 minutes or so, not days or weeks or months with maybe a prescription, although those can certainly have their place. It does interact with blood pressure medications, so along with any supplement I ever discuss in my videos, absolutely check with your physician or healthcare provider before starting any of these supplements, especially this one. However, it really can change your life, so it's worth asking. Just don't combine it with some blood pressure medications or anything else without checking first with your healthcare provider. It also can decrease the effectiveness of some stimulants like Ritalin, but one of the best things about it is it has a low side effect profile, and you get the calm and decreased anxiety and relaxation without drowsiness. That brings me to number 3, 5-HTP. So 5-HTP is one of my favorite all-purpose supplements for anxiety, depression, and even OCD. It is the precursor, it's an amino acid. It is the precursor to serotonin production in your brain, meaning that 5-HTP added will help your brain make more of its own serotonin. And serotonin deficiency is highly correlated with states of anxiety, panic disorder, and depression as well. So it helps with a variety of things, and studies have shown that it's also very helpful for weight loss and sleep, incidentally. And anyone who has had anxiety or depression knows that the less sleep you get, the worse you feel in general. So it's really a win-win. Most people start with around 50 milligrams and then add another 50 to 100 each a week. This is another one that you should feel a difference in a relatively short period of time. Again, check with your doctor. 5-HTP is not shown to be contraindicated with many medications, but always ask. You don't want to take this along with an antidepressant that's being prescribed to you at the same time, however. Okay, number 2. Inositol might be a supplement you've never heard of. So inositol is kind of considered a pseudo vitamin. It's actually vitamin B8. It was down-regulated from its status as a nutrient when it was discovered that our bodies are capable of making some of this on our own. However, a lot of people are deficient, and we have seen in some research that folks with anxiety and depression and panic have lower levels of inositol. Now, inositol is involved, it's a molecule involved, or nutrient, involved in nerve function and cellular communication, nerve signaling, and even fat metabolism. Interestingly, it's been shown to help polycystic ovarian syndrome sufferers as well as those with infertility. So it's a cofactor to a lot of the neurotransmitters that we've been talking about: serotonin, dopamine, norepinephrine. All of those are related to how the brain experiences anxiety and mood. Now, what's wonderful is that the research shows that not only is it statistically significant in terms of reducing anxiety and panic, but also OCD and depression. And results can also be seen, in a fairly short period of time. Most people start with 500 milligrams, and the dose range for various conditions, but particularly anxiety, is really from very low all the way up to 12 and even 18 grams a day. So for this, 1 teaspoon gets you 600 milligrams. So you would start, a quarter teaspoon, So you would start with just a quarter and slowly move your way up. Some people basically take several teaspoons 2 to 3 times a day. Again, check with your doctor. Okay, my number 1 favorite, and here's the reason, supplement for anxiety or panic, and this is the reason it's my favorite. It can work just like this. So lemon balm, I prefer it in tincture form. One of the beautiful things about lemon balm, it's an herb. It looks like mint, but it smells like lemon. It's actually an invasive herb. You might even have it growing in your backyard. You could make a tea out of it if you want, but it's a nervine. So it's an herbal nervine that decreases anxiety over the long term when taken in low amounts on a regular basis, but it can also be just as effective as a benzodiazepine when you're having an acute panic attack. So 1 to 2 dropperfuls at the onset of panic can absolutely help your nervous system get back to baseline, calm down, and feel, basically that feeling of in control again. So what's really interesting about lemon balm is it also has been shown to increase cognitive function. At higher doses, it can make you sleepy, so it helps with sleep as well. You're going to have to experiment with how your body responds to it and see what's right for you. Typically, people take it in either capsule or tincture form in 300 to 600 milligrams 1 to 3 times a day, just depending on their needs. Certainly can be taken within a half hour before sleep to aid in sleep as well. So I hope that this has been helpful for you. As I have said several times, but just want to be very clear, make sure you check with your doctor or healthcare provider before taking any of these. Some of these might be considered okay or not okay, depending on who you see during pregnancy or nursing. I see functional medicine docs that feel really good about all of them. Some Western medicine doctors might not feel comfortable. None of them have been well studied during pregnancy and nursing, and it's a need to make an educated decision and a cost-benefit analysis. For those of you who are suffering from panic and anxiety, the cost of exposing, an infant in utero or nursing to untreated anxiety, we do know that there's demonstrated research showing harm to birth outcomes and longer term child development. So do some more research, talk with your doctor or healthcare provider, see what's right for you, but know that there are lots of alternatives to prescription medications when it comes to anxiety and panic. I hope that this has been helpful. Please like, share, subscribe. Thank you so much for doing that. And until the next time I see you, may you be well, may you be happy, may you be at peace. Bye for now.